Okay, they're notifying all our
Let me
photos.
go on the medial part. There's just something, I want to shrink that down just a tiny bit more yet.
Alexa, stop.
Just like, I don't know, something right here. I want more.
Welcome everybody. We're doing an upper eyelid bleph in office, Corona, California, with board certified plastic surgeon, Dr. Salcedo, aka the Plastics Doc,
Plastics Dog.
aka TPDMD.
TMDPD. All right, good job, Reyes.
Sorry.
Start us off strong.
All right, Doc, and we got people.
All right. And you can, if you had your phone, you could notify people. You could let them know to watch your procedure. Okay, so check it out. We're kind of like winding down towards the end, but check this out over here. This is the skin we took off. We're doing an upper eyelid lift. There's the skin there. There's, Fridays are our ovule. We got 2 ovules today, and we've got blephs and all this other fun stuff. So we got that, and then you can see right here is where we took off the skin. So now we're gonna close it. That's the most important step, honestly, getting it closed.
First question, is he awake?
Yes, I'm awake.
Oh, no, he's answering the questions for me. Perfect. Okay, but then remember, you're not gonna be anonymous if you answer the questions. I'm fine with you doing it, but if you want to be anonymous. But I'm happy for you to answer questions if you want. Yeah, he's awake.
Yeah. Does it hurt?
No.
I love it. This is the first time we've had the patient answering the question. Do I need to give you a discount now, or are you like
Sure.
you're helping me here?
Take it.
Did they catch that? What he said?
Yeah.
No hurt.
You
Nah,
guys-
we give a little concoction of medications, and happy juice is what we call it, to get patients nice and comfortable. I say this every time I do a bleph, and I mean it every time I do a bleph. Suturing a bleph is like suturing 2 pieces of tissue paper together. The tissue is so thin. Especially when I'm starting off in the corner. This is like the one time you're not going to hear me talking or singing or doing karaoke, because I really have to just lock in on it. I said this is one time you're not going to hear me talking as I'm talking through it. All right, hold this right here. So these sutures go underneath the skin is the key. So you get nice, beautiful, scarless healing. It's not technically scarless, but what it is the incisions in the crease of the eyelid. So you don't see it. Oh yeah, like that. Beautiful. So once I feel good about it, then I start moving a little bit faster, but I really want to be just in this corner is the most critical part. I gotta focus. So Reyes, Jackie, you guys are gonna have to talk until I get out of this corner.
Okay, Jackie, we have a question on TikTok from MC Cali Gus. How long does this procedure take, PA Jackie?
Well, the procedure itself, that Dr. Salcedo's surgical part, about 45 minutes. But coming in, getting prepped, do all that,
I like that.
I think we allot for a couple hours.
Got it, thank you.
I think we allotted for 3 hours total in the clinic, but I think we'll be closer to 2.
Okay, Jackie, we have another question from Ghost. Is this an eyelid correction? Question mark.
Yeah, I guess so. Sort of a correct. I'm out of the corner, so I guess it's a correction. It's an eyelid lift, so we're taking off the extra skin.
There you go, Ghost.
So it is kind of like a correction in a way. We're correcting the excess skin that he's got.
Thank you guys so much for the questions.
And we're correcting the excess skin that he's got.
Thank you guys so much for the questions.
That nice little closure there. See, you can see the suture. What's up, D-Ray?
All right, we have another question. How long does it take to heal?
Great question. Great question. I tell people not to plan anything for at least a week. You're gonna have bruising, you're gonna have swelling. It's pretty well healed. This heals so quickly. There's so much blood flow in the face. These heal extremely quickly, but some of the swelling and bruising can last for a week, sometimes even 2 weeks. So I tell people not to plan for anything super important within the week or two after this procedure. So you don't have any events, right? I'm pretty sure we cleared that with you.
Right. And hide from TikTok. I had it done.
After this procedure. So you don't have any events, right? I'm pretty sure we cleared that with you.
Right. And hide from TikTok. I had it done, so please.
Oh, wonderful.
Where did you get it done? Let us know in the comments below.
Good question. Don't shout out if it's another surgeon. Just tell us where location.
Yeah, tell us the location.
We're not, no, I'm just kidding. We're not trying to give everybody else their flowers.
And our TikTok question from I'm such a bow pong. That's kind of scary.
A little bit. Yeah, from a non-medical perspective, I get that. It looks a little like something, but look at how not scary that's gonna look. And if I have him open his eye, go ahead and open your eye. That's gonna be right in the crease. Okay, go ahead and close them. Beautiful. So he's just doing amazing. Perfect. That for me, please.
And Mary the Grandma on TikTok said, how long is this procedure?
Good question. One of our most common questions. We should make that a FAQ, right? On the next live. Should I work on that? That seems a little robust, doesn't it? Let me see. 45 minutes of like actual operative time.
And Becky asked, is that a lip or an eye? It is an eye.
It is an eye.
And somebody said, man, we got TikTok surgeons now?
Yep.
And somebody said, man, we got TikTok surgeons now?
Yep. Yeah, educational content. So we've got a little bit of bleeding here. I'm going to see if I can just tap it and calm it down. Yeah, I think it's right there. Ooh, but I don't want to touch the suture. You know how that goes. Open it up just a little bit.
Try to hold the suture up.
Nah. Where's it coming from? Let me just see.
Guys, if you guys have any questions, drop it in the comments below. We are located in Corona, California. Board certified plastic surgeon, the plastic doc. We do a lot of tummy tucks, breast dogs. We also do chin lipo, total defineness. You need abs.
You're just oozing on me.
Come on.
So check this out, Reyes. Show them this. This is kind of a neat thing. Okay. See how we suture it back and forth, back and forth, back and forth. Watch this. It's a running continuous subcuticular suture is what it's called. But watch when I pull it. It just zippers close like that. So sometimes for the gram, we used to just not even close it fully. We would do all those back and forth, back and forth, back and forth. And then at the very end, we'd pull it and the whole thing would zipper close and actually look really cool. But that's what a running subcuticular suture is. And that's what's underneath the skin that's holding everything together. Now we've got TikTok surgeons. I don't think I'm the only one. I wish I was. I wish I could corner the market. But by the way, guys, patient's consented to this. Patient is awake. We're not under general anesthesia. We're using the best ACU care as our number one priority. And this is like a local procedure in office, so we're not using anesthesia. The patient's not at any risk or any harm here.
And we got some love from Instagram. Freshiest.
The patient's not at any risk or any harm here.
And we got some love from Instagram. Freshiest Frenchies. I love that you do it live.
Oh, thank you. Well, I'm glad you guys enjoy it. It's all about the education.
And we got some love from Instagram. Freshiest Frenchies. I love that you do it live.
Oh, thank you. Well, I'm glad you guys enjoy it. It's all about the education and getting the knowledge out there. Sure, on TikTok and the gram, share it if you know anybody who would benefit from this or has questions about it or who has thought about it, so they can see what it actually looks like and see that we've got our patient here doing amazing, awake and amazing.
Have to be awake for this.
No, you don't have to. But the thing is, if we don't have to use general anesthesia, I prefer not to, right? There are risks to general anesthesia. And in a procedure like this where it's not really necessary, I prefer to avoid it. It's always best to minimize general anesthesia if possible. But I do tons of procedures under general anesthesia. It's safe. But for something like this that's really straightforward, it's not necessary. But I do it sometimes. I think next week we have a upper eyelid in the operating room. Yeah, we won't go live for that because we don't go live in the operating room because patients are asleep. There's anesthesia and all that. We usually post stories, so check out those stories. Why don't you introduce PA Jackie and Nurse Desiree? We got Nurse Desiree here. She can talk about the wonderful things that we do here. Is that okay, Nurse Desiree? Yeah, okay. So we got PA Jackie here. She's my right hand gal.
All right, PA Jackie, what do you do for Dr. Salcedo?
For the plastics doc.
What don't I do for the plastic stuff?
TBMDP.
I assist him in all his surgeries. So I'm in the operating room. Whenever he's operating, I'm there.
By the way, do a little checkup. This side's closed. So there's the eyelid closed. There's not closed, closed. And then here's the skin that we took off. So there's the eyelid closed. There's not closed, closed. And then here's the skin that we took off. One side was definitely worse, and we see that all the time. All right, security sutures. I can probably handle this one on my own.
Do you want me to use it or just continue?
Continue. I'll pop down there.
Do you want?
All right, toss this one off. Hand me another one, please.
Sir, go.
To show the skin. And then Nurse Desiree. D-Ray is what I call her. It's my nickname. Everybody gets a nickname. What are we trying to do? 5-0 fast? I think we're going to do 4-0 chronic.
That's chromatic.
No, that's
We are located in Corona, California.
So go ahead and close it.
He does a lot of breast tugs, tummy
And then we're gonna
tugs.
use 4-0.
He does liposuction.
Oh, it's not here?
But he also has a med spa, skinny shots,
There you go.
Botox, fillers. And talking about Botox and fillers, Nurse Desiree.
Wow, Reyes, you're kind of
Gee, I haven't had my coffee, doc. Damn, I'm sorry, guys. I'm sorry.
Hi guys, I'm one of the nurses here with the plastic stock.
She's a plastic surgery nurse.
I'm a plastic surgery nurse. I'm going to be assisting the doctor with all of his in-office procedures as well, as you see, and injectables as well.
For someone who doesn't know what injectables we offer, what do we offer?
So we do everything. We can do lips, we can do Botox, we can do chin, jawline. I'm going to be learning threads soon, so possibly threads we'll be doing.
Instalift,
It's called
specifically.
Instalift.
Because
they
I
are
have
very
thoughts
great.
about threads.
Yeah.
I traditional kind of PDO threads, I'm not a big fan of. Go ahead. I'm not the hugest fan of.
Can you? I need a suture.
Here.
There's not one in here right
Take this one. No, it's fine. We're fine. I'll use that
Are
one.
you sure?
Yep. Take this. No, you don't need that. You can use that one. We're good, D-Ray.
Okay.
Yeah, I don't like traditional threads because I don't think they last that long, and they talk about promoting collagen. I don't like it as a lift. What I'm hoping with the Instalift is it'll actually create a sustained, long-lasting lift. Anyway, sorry to interrupt you there, D-Ray. Go ahead.
No, you're good.
Go ahead.
Also, we're going to be doing ovulate treatments. So ovulate is a cellulite treatment. So for
Got
anybody
two
who
of them
wants
today.
to, yeah, we have 2 procedures of ovulate today. They're very exciting. So for any of you girls who want, or men as well, who have cellulite on the buttocks area, those dimples, we can help take care of that, and they go away forever.
They want more information. What can they do?
What can what do? Sorry.
Somebody wants more information on what we offer. Instagram.
We're on camera. We're
You know,
testing our skills.
Give us a
our life
call,
skills.
send us a DM.
Yeah. you
All the
guys
good stuff.
can Come
Do you
over,
remember what it
have a
was like to be
consult
on
with me
camera
or
for
the
the first
doctor,
time?
whatever you guys want to do. We do liposuction, breast augs, tummy tucks. We do it all.
Thank you,
Thanks,
Desiree.
Just pin our number, the website, Instagram, TikTok,
Yes.
all of that.
There you guys go. A lot of ways to contact us. And then we have a lot of new viewers right now, Doc, and they're like, what are you doing?
Upper eyelid lift. So we're closing this side. That side's already mostly closed. We're just putting in some security sutures so you can see how nice that looks now with all that extra skin off. You can show the skin that we took off if you can move the 5-0 package, Jackie. That's actually the skin that we took off from each side, one eyelid, and then the other eyelid. And now I'm working on this side to close it up.
All right, if you guys have any questions, drop it in the comments below because we're almost going to be done. And then Becky said, oh, wow, thank you for answering.
Yeah, of course. So let's publish it on Instagram because who did you want to see it? You don't say the name, but who did you want to see it?
Oh, my wife will check it out.
Your wife? Okay. So we'll post it up so his wife can check it out. So get some good content for her. So she can see the process of how we closed it and everything. And I'm just putting in these delicate sutures like I did on the other side. This is really the heart of it. And what Jackie's doing is putting in, I call these security sutures. They just help me sleep better at night. It's like an extra 1 or 2 sutures on the outside that takes the tension off the incision. And I haven't had any issues ever since putting in security sutures, and they just, maybe it's a security blanket for me, but it just makes me feel better.
And these dissolve on their own.
And they will dissolve on their own. Yeah, very good point. Not these, not the one that I'm putting in. This blue one that I'm putting in does not dissolve on its own. This one has to come out in a week.
And we have a question from Miss Ma'am on TikTok. Wait, I missed it. Is this being done under conscious sedation?
No sedation.
Miss Ma'am on TikTok. Wait, I missed it. Is this being done under conscious sedation?
No sedation. Patient awake. We use local anesthesia, meaning we inject lidocaine just like when you go to the dentist. The lidocaine will keep you numb, but definitely not conscious sedation. We give a little happy juice, kind of like a Xanax or something, so that patients are feeling very comfortable and not anxious. And that beeping you hear, that and not anxious. And that beeping you hear, that is never feel bad doing more. Then you never have to wonder, should I have done more? Because you're always doing the most. Kids nowadays would say I do the most. Don't do too much, but I do too much.
And then we have a question from TikTok. Why are you live?
Why not? Education. So send this to someone who may be interested in this procedure or who's wondered how this procedure is done or who has ever had a question about whether this could be done awake and whether it's painful. That's what it's for, that educational aspect of it. We're not under general anesthesia. The patient's fully awake and consented to this. So that's why. Education.
And MC Cali Gus from TikTok. Are you going to be live for more things today?
Yeah, we have 2 ovules today. We'll have to see what their social media status is on those ovules, but yeah, if we can, we'll go live on those as well because those are also awake procedures. Fridays, are our big awake procedures days. We don't do anything in the OR. We just kind of have clinic and then also do minor procedures. We'll do like earlobe repairs, upper eyelid lifts, ovule, radiofrequency microneedling, all the good stuff.
CO2 lasers.
CO2 laser, thank you. Yeah, absolutely. All the fun stuff that you don't have to go to the OR for. And the nice thing is a lot of those are face procedures. The face has so much good blood flow. It heals well, you recover quick, and we like to use our CO2 lift to help patients recover even quicker.
We have a question on Instagram. How long is the recovery?
Recovery is about a week.
Repeat that.
I tell people not to make any major plans for about a week, because you're gonna have bruising, swelling. Are you feeling it on my side a little bit, or yeah? So right about now, I've got maybe like 2 or 3 more sutures to put in, but let me know if I need to put in a little more numbing medication. I can. Okay.
Jackie is suturing. Are you done? I have an injectable patient.
Oh, wonderful.
I'll do that.
We're just about done. Hey, we're probably 5 minutes out.
Okay.
And you get some love on Instagram. Freshiest Frenchie said, I'm an LVN to RN nurse, and this is very educational for us, especially if you're looking to get work done or looking to work in this field.
Okay, awesome. Hold on 1 second. Do you want me to put some numbing in there? I have maybe 2 more sutures, but if it's feeling, yeah, here, hand me the local. So this is the good thing about doing it awake too. If the patients feel any discomfort, I just give them a little more numbing. Not a problem. All right, I'm gonna give you just a tiny bit. You'll feel the poke. So this is the lidocaine. I'll give it about a second, and then you won't feel a thing. So lidocaine's in here, just like a dentist would inject into your teeth. Now, here's the one thing to let you know. You'll have a little more swelling here, okay? So don't,
Because of lidocaine.
yeah, exactly. So don't worry about like, hey, the this edge here is a little more swollen. It's gonna be because I put more numbing fluid into it. All right, I'll give that 1 second. Usually the lidocaine kicks in pretty quick. I can't talk either. It just kicks in pretty quick, maybe in a minute. Full effect in 7 minutes, and then you can see it kind of wears off within an hour. So you're not numb all day, just a little bit.
And somebody said on TikTok, why are you distracting the nurses when you're talking? But somebody backed you up. Gianni, trust me, he is not distracted. He's a magnificent plastic surgeon.
Oh, my man, my person Gianni. That's what's up. Thank you. Wait, and I'm distracting the nurse? Oh, no, he's saying you're distracting. Am I a nurse? Or am I distracting a nurse? Who's the nurse? I'm the surgeon.
I'm the PA.
And she's the PA. Yeah. There's not even a nurse in here. We got surgeon and PA. That's like the highest level.
And we have another person on
All right,
Instagram.
let me know how this goes, okay? How does that feel? Better?
Uh-huh.
All right, perfect. Go ahead, Reese.
Instagram said, no other surgeon is doing live cases. Hands down, the best surgeon ever.
Thank you.
And give you
Well, I'll tell you this. We're not under general anesthesia. The patient's fully awake. There's no sedation going on. It's just lidocaine, so local anesthesia. So just so you guys know, we're not taking undue risk here. The patient was gracious enough to allow us to do this for educational content, and he wants to show his wife. So she's going to be able to watch this afterwards. And, you know, when we do these things at this high level with the way that we do it, I'm okay with, sharing the video, getting the education out here, and allowing this patient to have his wife watch it later, so it's kind of a win for everyone.
All right, guys, we're about to wrap up. So if you have any last questions, please drop in the comment below.
A
We're
little poke there. But
located in Corona, California. Breast dogs,
Perfect.
Tummy tucks, eyelid blephs.
Perfect closure. Yes. So take a look. How you feeling?
Good.
Good. Excellent.
My right side is still a little achy, but just
So that's when I'm going to say we should do the CO2 lift.
okay.
That's good. It's going to be, so we'll do a CO2 lift as well, which is our carboxygel mask, and that'll help out a lot with that. Let me see, security sutures. Nice. Now, where I really like security sutures are always in the corners. So corner and corner.
I thought this was such less tension, but no, there wasn't.
I don't know.
Because
I get paranoid.
I put double in this corner always.
I'm just paranoid. You're right. You're right. I just. It's my anxiety.
They don't come out.
That's the skin he removed from the
They
eyelid
dissolve.
bleph.
Those. There's the ones that.
Is it put in there so they don't actually get pulled out or something?
Yeah. So you'll see on the video if you end up watching it later. I do one layer that goes underneath the skin that you don't even see. It's a blue suture. That watching it later. I do one layer that goes underneath the skin that you don't even see. It's a blue suture. That one I take out in a week. The other ones they dissolve on their own, and yeah, they're just like a extra safety.
Well, it just take for them to dissolve out.
Probably 2 weeks, maybe a week.
We're located in Corona, California. We go live every Friday.
Yeah, not really. They're really
But
small.
if you like this content, make sure to give us a follow. We post content every day, befores and afters, testimonials, the process. You really enjoy it.
Exactly.
So make sure to give us a follow. Send us a question and share it with anybody else. Somebody said, can he blink afterwards?
Yeah, definitely. Sometimes, and this is good information for you as the patient, sometimes the eye will be a little bit hard to close initially because of swelling. I actually am not seeing that with you. It actually looks like you're not having that at all. So that's good.
The ointment, is that something that you go over and how to put it on?
Yeah. Yeah, it's
I brought
just,
it just in case.
oh, perfect. Yeah. It's just like, you just put it on the incision. Super. Reyes, can you tell him to bring up have somebody come up and talk to him about the CO2
You got
lift mask?
the CO2 lift mask coming right up. All right, guys, we're gonna take a quick little break. Well, there you go. Give me 1 second. Hey, this is Reyes. We need somebody to come up to room number 3 to talk to him about the CO2 lift mask, please.
I've never had anyone say, oh, I wish I didn't get the CO2 lift mask. Like, trust me, it's a benefit for you. Yep, so there's the skin we took off. Retones.
There you go. Let's go check out the skin that he removed.
And it looks so good, man. You're gonna love it. It looks really good. Yeah. Yay. Now you'll like it.
And you getting some love on Instagram. Dr. Salcedo did my breast dog. I had no pain.
Oh my goodness, thank you.
It's gonna be one of those things where people are like, what do you do? I can't tell.
Yes, exactly. Our motto is everyone will notice, but no one will know. Meaning they're gonna know something was done, but they're not gonna know what. They're not gonna know how.
And since you mentioned this,
I lost my weight from surgery.
There you go. Yeah.
you mentioned CO2 lift mask. Somebody's asking, what is that?
It's a carboxygel mask, and what it does is it infuses carbon dioxide into the skin. It's like a topical, if you've ever heard of hyperbaric treatment, it's like a topical hyperbaric. It just concentrates blood flow and oxygen into one area, and that helps with healing, helps with pain, helps with bruising tremendously. I've seen big changes in bruising after procedures with the CO2 lift mask. If you tune in, maybe we can go live shortly. We'll cut this live in a little bit, and then we'll go live putting on the mask so that you guys can see what that actually looks like. And your wife can see it too. But yeah, that's it. We're done. So that's what it looks like. It's closed. You saw the skin that came off. Now we're just doing the finishing touches.
If you guys have any questions, send us a DM, give us a call, Corona, California. Share any of our content with anybody who you think might be interested in the procedure.
Reyes, can you call for another 5-0 fast cut up here?
Yep.
Oh no, the needle came off for first suture.
Hey, this is Reyes. We need a 505 FASCA ASAP on room number 3, please.
I don't know.
You ask people when they come in, hey,
Does anybody copy?
Yeah, I do, but The thing about social media, like Instagram and TikTok and all that, it's like you have to have 7 to 9 touch points, right, before someone makes a decision or decides to do something. So I feel like on the
Is
marketing,
it the yellow one?
yes, on the marketing standpoint, it's just an additional touch point. Like I don't think anyone
They use
makes their decision based
They
on
already
it. But
used
let's say they
it
saw me on a
and need another
billboard
one.
or in a magazine, and then they see the TikTok live, and they're like,
research.
Okay.
yeah.
You need another one,
exactly.
right? Got it. She's coming.
Thank you.
The most is from Google, from online. That's where
You don't think a lot of it's from word of mouth from other previous patients?
I wish it was.
Hey, DD. Yes, this is an upper bleph.
I mean, yeah. I mean, we get some of that. I wish it was more. You know, we're still, you know, we still have to hit that critical mass where there's enough people telling other people.
MPA Jackie, we have a quick question. Do we do brow lifts?
No, I don't really do brow lifts. I would usually refer to someone else for that. There's a few things that I just don't enjoy doing, and one of those is brow lifts. One of those is medial thigh lifts. I'm this close to stopping doing lower eyelids. We'll see. Yeah. Okay, let me help with getting that. All right, so we're done. Okay, it's just we're gonna put security sutures on one other side, and I'll have to get the CO2 lift mask. Okay. All right, guys. Any questions? DM, send us a comment, whatever, and we'll get back to you.
I guess we might go live later, so stick around. Make sure to give us a follow.
Yeah. Follow us because we'll check on social media to see if our Ovally patients are down with social media.
There you guys go. Thank you for tuning in.